Hello, I'm Mary Colbert, and welcome to part 2 of Dr. Colbert's Divine Health podcast in the Healthy Brain Zone. If you missed the first one, you need to watch it before you watch this one because it's so chock full of good information. But we're going to keep going because, Don, you're just full of information.
Well, Mary, we didn't get to talk about the Alzheimer's gene.
Okay,
and this is so important because realize that 25% of the population in the U.S. are positive for the Alzheimer's gene. If you have a single mutation in this gene, you stand a 30% risk of developing Alzheimer's. Now, I have a single mutation, so I'm following this program because this will protect my brain and it'll help protect your brain against Alzheimer's disease. If you have a double mutation or 2 copies of the Alzheimer's gene, you stand a greater than 50% risk of Alzheimer's, and you really need to be listening to this. Now, I encourage all my patients, if they're having memory loss, there's 2 key tests that I do on these patients. I tell them we've got to do these. Number 1, your homocysteine level, and number 2, your APOE gene test. And the doctors, unfortunately, are not doing this, so you have to request this. You can also read my book, and on page 184, I have a list of all the tests I recommend. Now, again, I do a lot of testing. I don't have to do all of these tests, but I do key tests. And 2 of the most important is especially the APOE gene test, that is your Alzheimer's gene test, and your homocysteine test. Now, talking about how to, once you have the APOE gene, you have to realize you're at a much greater risk, and there's certain things we need to do. First of all, if you have the gene, the Alzheimer's gene, you're more prone to have high cholesterol levels as well as increased risk of heart attack and stroke. So you have to lower your saturated fats. Really important, to less than 7% of your calorie intake. What is saturated fat? Saturated fats are found in high-fat dairy like cheese and butter and cream and coconut oil and fried foods and fatty meats like ribeyes and burgers and bacon and sausage and just all hot dogs and salami and bologna and pepperoni. You say, wait, I can never have these fats. Hold on, I'm not saying that. I'm saying if you do eat a lot of cheese or a burger or a ribeye or anything fried or coconut oil, and please don't cook with coconut oil, cook with avocado oil. These are high in saturated fats, and take fiber like our Fiber Zone. Within an hour of having it, it'll bind the majority of those saturated fats. The more saturated fat you have, the higher your cholesterol goes, the more inflammation you'll have in your brain, and it'll speed up the development of Alzheimer's. You want to limit the saturated fats. Number 2, people with the Alzheimer's gene are more prone to have insulin resistance in the brain at an earlier age. What is insulin resistance of the brain? The brain cells are unable to take up glucose as well as they should. The brain is struggling for fuel. And I see this even in my teenage patients who have this gene.
Wow.
You may have a son, a teenage son, who's having problems in school. They just can't remember. And lo and behold, you do this test and you find out they have a single or double mutation of the Alzheimer's gene.
And they call this type 3 diabetes
Type 3 diabetes, correct. So it's really important. If they have this, we want to put them on my Beyond Keto diet is the healthiest diet for the brain, either the Mediterranean portion, but even better is the keto portion of the diet, the healthy keto, not the unhealthy keto diet that we hear about in so many bodybuilders and people like that are doing this, because it does help with weight loss, but this protects the brain. So again, also, if you do have insulin resistance of the brain, pre-diabetes or insulin resistance, our Carb Assist, it's a supplement that is absolutely amazing, and here it is, right here. I'll let you hold that up, Mary, I know. But I put all my patients with pre-diabetes or diabetes on Carb Assist. It has nutrients that help with glucose metabolism and help to support healthy sugar levels. Why? It has berberine, it has chromium, polynicotinate, and alpha-lipoic acid, and Ceylon cinnamon in it. All of these are wonderful for supporting healthy blood sugar levels as well as vanadyl sulfate.
And it actually turns down the appetite a little bit.
A lot of my patients tell me that, Mary.
Swear that it actually kills their ability to want to be so hungry, so that's good.
Now also, if you have the APOE4 gene, and that's the Alzheimer's gene, you have to realize that alcohol is your enemy. And so many people I see especially at our condo, they have to have their wine every night. They have their Wednesday wine down and all this, and they say, come to my Wednesday wine down. And I say, I don't drink alcohol. And they say, why not? I says, I don't want to pick on my brain, because if you have the gene, which I have the minor gene, and you drink alcohol, it literally pushes you toward Alzheimer's disease. And so especially if you're 65 and over, you're pushing yourself to be that part of the 50%. At age 85, they have Alzheimer's, and many of those will end up in a nursing home. You don't want to end up in a nursing home. Literally the rest of your life, it's over. It's over when you're in the nursing home. So again, alcohol is not your friend. The other thing is moderate head trauma with loss of consciousness or post-traumatic amnesia will double the average person's risk of Alzheimer's disease. But if you have the Alzheimer's gene, the single or double mutation, it will increase your risk by 10-fold. This is why it is so important, if there's a positive family history of Alzheimer's and you have a child that wants to play football or mixed martial arts or soccer or lacrosse or high impact sports with high potential for head injuries, you want to get the Alzheimer's gene test, the APOE gene test, to see, if your son or daughter has the APOE gene, you want non-contact sports. That will not predispose them to brain injuries. You don't want to put them in motocross or things like that, or boxing and things like that, because you're pushing them toward Alzheimer's disease.
There's too many other sports and athletic events you can do.
Track and field, absolutely. Track and field, swimming, tennis, absolutely. And even, got to be careful with baseball. Basketball is supposed to be non-contact. It is for the most part. So again, choose sports that are not a high risk for brain injury, concussion. That's where it pushes you toward Alzheimer's. Now, I want to talk now about the 10 Dementigens, Mary, because in my book I list 10 key Dementigens, but I want to go over just a few especially important ones that so many people don't realize they're pushing their brains toward dementia by consuming these products.
And when Don says this, it's like, you know, they have carcinogens.
Yeah, a carcinogen is a substance that causes cancer. A dementigen is a substance or chemical that can cause dementia. So it's very similar.
Understand, yes.
Now, one of the most common we see is mercury. And the two most common ways where people get mercury in their bodies is, number one, through silver fillings. You say, silver fillings, how's that mercury? Well, approximately 55% of the material in a silver filling is mercury.
And every time you chew something hot or cold and you grind, that mercury vapor is being released to your brain.
And what they've shown is the average mercury filling releases about 1 microgram of mercury per day. And back in the 90s, they did studies on sheep, and they put 12 amalgam fillings in the sheep, and then they saw where the mercury went after 1 and 2 months. And the majority of the mercury actually went to the sheep's kidney. And the kidneys were compromised, and the kidneys function at about half the efficiency after 12 amalgam fillings were put in the sheep. Now we know that the mercury also migrates to fatty compartments in the body, including the brain. And what mercury does to the brain, it creates the same beta amyloid and tangles that Alzheimer's produces.
Wow.
So again, the mercury fillings, now don't run out and get all of these fillings out. I tell you what to do if you have these. Once you've had fillings for about 25 years, the majority of the mercury is already out.
It's already in your brain.
So, no, it's in your kidneys and throughout your body.
Okay, wait a minute. So if that's the case,
well, we need
to talk about our glutathione.
Yes, and so again, what we do, we have some key nutrients that will help to pull mercury out. One is infrared sauna, and people have access to infrared saunas at some health clubs, and you can get them at Sam's now, an infrared sauna. We have one at our house, which we use and use especially.
This product, the glutathione, you spray it 4 times.
This is a special kind of glutathione. It's a nano-sized glutathione. So the majority of this is absorbed just as you spray it in your mouth. 4 pumps in the morning, 4 in the evening. And the glutathione is the master detoxifier, and it binds metals and chemicals in the body, and it helps to flush them out of the system.
And it's not too bad tasting. It's really not. It's not gaggy. You can do this. It's got a raspberry flavor.
But if someone has had lots of mercury, they may want to do 6-hour mercury, 6-hour urine for toxic metals and see how much mercury they have in their urine. There's chelating agents they can use to get rid of mercury. There's DMSA, there's DMPS, there's alpha-lipoic acid. But my favorite and the mildest is just glutathione. There's different glutathiones. I like the nano glutathione because it's a nano size that works really good, but there's other glutathione products
this
too.
is brand new. This nano is brand new. So we're most excited about it because the technology of it is so new and it goes right into your bloodstream, which is really, really huge. You know, any supplements that you take has to go through your stomach, break it down for it to get in. This bypasses that, so that's pretty cool.
Now let's talk about some of the fish that are high in mercury, because most people don't realize it, and so many people are out eating fish a few times a week because they say, oh, fish is so good for me, and it's so lean, and so but they're getting lots of mercury. And so many of my patients, when I check mercury levels on them, they're off the chart, and I say, you're eating fish, aren't you? Yeah, 3 days a week I'm eating fish. What kind of fish? Well, these are the fish that are high in mercury. Shark is always high in mercury. Avoid shark like crazy. Swordfish, marlin, orange roughy, king mackerel, tilefish, and big-eye tuna, but also ahi tuna. Any kind of tuna. The only tuna that's low in mercury is tongal tuna that you get from the health food store. It's baby tuna. So I personally I rarely eat tuna because it's high in mercury.
Yeah, yeah.
Also, there's smaller fish that are real low in mercury, and these include wild salmon, wild mackerel, not king mackerel, that's high in mercury, anchovies, sardines, and herring. But other fish that are low in mercury are flounder, cod, tilapia, trout, and always choose wild fish instead of farm-raised. And so many people are choosing farm-raised fish. Why? Because wild fish doesn't contain the toxins, the antibiotics, the chemicals, as well as the pesticides. Realize farm-raised fish are raised in pens in the sea. They're highly crowded. They're given tremendous amounts of pesticides because they have sea lice problems, sea lice. So they give pesticides for sea lice, and they still get sea lice. They give them tons of antibiotics. There's all this fish poop around that they're getting ingesting.
You know what, it was amazing to me to learn is about salmon. The salmon that is farm raised, the color is white, and they have to give it a pill.
Yes, a dye
to dye it pink, but it's for the stores and stuff.
And farm-raised fish is so much less in nutrients, especially the powerful DHA, which is the powerful omega-3 that protects the brain. It doesn't have the amounts that the wild salmon will have and the wild fish has. Also, these farm-raised fish are high in PCBs and dioxins. These are chemicals that have been banned since 1979, and they were used in the transformer industry, and yet they caused all kinds of problems in animals. And what they found in fish is that PCBs, or excuse me, not fish, but in animals, they found that they are linked to cardiovascular disease. PCBs are linked to liver and bile duct cancer, whereas dioxins are linked to multiple myeloma as well as prostate cancer and lung cancer.
Where is these dioxins coming
They are in farm-raised fish. They're also in meats and dairy.
Because it's in the water?
It's in, yes, but they're ubiquitous. And they are stored in the fatty compartments in fish, in dairy products, and fatty meats. And so when you're eating a lot, and that's why the unhealthy keto has lots of steak, lots of fish, and many people eat the farm-raised fish, and lots of dairy, high-fat dairy, contain these toxins that are associated with cancers as well as all kinds of horrible side effects. So we want to avoid those if at all possible. And if you eat these, you know what helps to get rid of the dioxins and the PCBs? Glutathione.
Oh, well,
Glutathione's absolutely wonderful, but I don't recommend eating many of those. I avoid them. That's why I don't eat farm-raised fish, because especially of those dioxins and PCBs in farm-raised fish. Those are toxic fish.
Okay.
Now, as far as...
Can I talk about some of our products real quick
absolutely.
for the people that are watching? If they're not familiar, Beyond Keto, the book, you need to get a hold of this book. You can go to our website, drcolbert.com, and get a hold of it, or Amazon, or wherever books are sold. You want to follow this program. This you can live on. Keto, short term, is good to lose weight, but then you want to switch over to the lifestyle.
That's
forever.
a healthy keto and or Mediterranean. Both are very good for the brain.
We call this the reversing Alzheimer's diet.
Yes.
It's so good and it's so healthy. Don's book, what we're talking about today, is The Healthy Brain Zone. You need to get a hold of it because there's just too much information we're not going to be able to cover here today. Now, the 3 products, we call it the Healthy Brain Zone package.
Yeah. And they can just start with Brain Zone Basic. That's probably the most important of all 3.
That's the most important.
Because that lowers homocysteine. And invariably, the majority of my patients have high homocysteine levels.
Now, what causes high homocysteine?
Just eating the standard American diet, not having enough of the active forms of the B vitamins.
Okay.
Especially, about 40% of the population have a mutation in the MTHFR gene.
Okay.
And they need the active forms of the B vitamins.
Active form.
Yes, and we have
and
the
not
active.
all Bs are active.
No, they aren't.
Okay.
But it also contains trimethylglycine that lowers homocysteine.
Okay.
It has the active forms, like I say, and it has the turmeric or curcumin that binds the beta amyloid. So
and it's orange.
Well, it's orange, yes, because of the curcumin.
Because of the curcumin. So it's normal when you open the inside of the container is all orange because of all the orange capsules. That's totally normal. So, but we take this every day. And then the basic,
that's the basic. Then the advanced contains the 7,9-dihydroxyflavone that helps to boost brain-derived neurotrophic factor, and the low-dose lithium, and the lion's mane mushroom, and the acetylcholine that helps to boost acetylcholine levels that help, again, it helps charge the brain.
You know what he's done? Don has gone and he has taken the time to research all these things that are healthy for the brain, for healing of the brain, to protect the brain, and he's made it real simple in 3 products. So you don't have to have 20, or 30 pills that you're having to pop.
Right.
This is a powder, and it tastes amazing. This tastes amazing. It was too sweet,
and that's for focus
but now it tastes
and attention.
Perfect.
It really helps my patients with their alertness and their ability to focus. So many people get so tired in the afternoon. This does not have sugar in it. It has D-ribose that tastes just like sugar, but it helps the brain to focus, as well as green tea extract, as well as it has alpha GPC, which helps to boost acetylcholine. So it's amazing for focusing and helping patients' attention.
So Don's taken the thought out for you so that you can do it. It's easy, it's simple. Go to our website, drcolbert.com. When you become a partner with Divine Health, you're enabling us to be able to do this. We have a mission. Don wants to cover every disease he's ever treated and had to deal with as a practicing physician now for over 30 years. And so we want to put it out there for the world to learn what to take, how much to do, where to get the blood tests or the supplements or whatever it is that you need. We want to get this information out there free so that people around the world can get the answer. And you help us. We want to heal people one person at a time, and I think we can do this through this podcast. So we thank you for helping us by being a partner with Divine Health.
Now, we're talking about Dementigens. One that very few people know about are mold toxins, Mary. 25% of the population do not have the genetic ability to bind the mold toxin with an antibody and to excrete it from the body. So these mold toxins build up in their bodies and in their brain and unleash chronic inflammation, which literally starts to destroy the memory. They get terrible brain fog. I see this in young patients. I see that in patients in their 20s and 30s, even in their teens if they have this genetic glitch. And literally 1/4 of the population has this. If they're exposed to water damaged buildings from storms, leaks in the roof, leaks in pipes in your home, leaks from sprinklers coming through the wall, any kind of water damage, literally the mold toxins will continue to grow in that particle board or drywall, and this unleashes tremendous inflammation in these patients. Here are the symptoms, just list of the symptoms it causes. They create usually these ice pick-like headache pains, like someone stabbing you with an ice pick through your brain. They also have vibrations and pulsating sensations and electric shock sensations that run up and down their spine or tingling in different areas of their body. They have excessive thirst, excessive urination, also irritable bowel syndromes. They have abdominal bloating and cramps and diarrhea and or constipation, as well as they have just muscle aches and pains. And a lot of times it's almost like fibromyalgia. Many of these are diagnosed with fibromyalgia, and many are diagnosed with MS-type symptoms or pseudo-seizures. But it's this mold toxins. If you have these symptoms, please read Chapter 7 in my book, The Brain Zone. It tells you about this and what you can do about it, what tests you can have done. I list a battery of tests to confirm if you have it. These are tests that most doctors know nothing about. We check like transforming growth factor beta 1 as well as C4A complement levels and other tests. And so again, these are important. And then find a doctor who knows how to treat these conditions. You have to bind these mold toxins in the gut. First, you got to get out of the mold infested area, move to a different area or get to a different place where you're away from mold toxins. Have a special air filter that'll filter out the mold toxins, and then take binding agents that'll bind them, such as cholestyramine, which binds these mold toxins, or find a doctor who knows how to treat this. And I talk about it in my book in Chapter 7, like a shoemaker doctor who's been trained by Dr. Shoemaker, who really, these patients or these type doctors have really gone in depth on how to remove mold from the body. So it's extremely important. That's a dementia. Another dementigen that most people don't know about are anticholinergic meds. Mary, I'm shocked at how many patients come in my office.
That's a mouthful, Dawn.
Anticholinergic meds are meds that can include allergy meds.
Okay.
Like for allergies, seasonal allergies, as well as irritable bowel meds. So let's just go over some of the most common.
Okay.
Anticholinergics literally inhibit acetylcholine, the major memory neurotransmitter of the brain. You are blocking your memory nutrient in the brain, neurotransmitter.
Do you hear that? Do you hear that? I hope they hear this.
Now, many antihistamines, or some antihistamines, have powerful anticholinergic actions, such as Benadryl. Now, the stats are this. Anyone that's 65 or older that has been on one of these anticholinergic meds for 3 years or longer stands a 54% greater risk of developing Alzheimer's disease. Is that nuts?
Now, I know everybody who's watching saying, okay, wait a minute. Why didn't my doctor
They don't know this. They don't know it. This is new information.
Oh,
But
boy.
let's just go through a few meds, okay?
All right, okay.
Let's just take the allergy meds that are commonly used to treat allergies. Well, Benadryl, which is diphenhydramine, has powerful anticholinergic action. It is inhibiting your acetylcholine, that is your main memory nutrient.
Wow.
You're pushing your brain toward Alzheimer's.
Gee.
Also, Atarax, which is another common antihistamines that many doctors prescribe. You say, well, what can I use? You can use Zyrtec, or you can use Allegra.
This is a big allergy season right now, so I'm sure
exactly.
people. But you know what I like best? I like our Healthy Sinus allergy formula.
Oh, sure.
I travel with it. I take 4 because we get
too.
around
That's
the
what I take.
molds. We get around all the different environments as we travel. Boom, boom. I take 4. Boom, it turns it
Right, so
off.
I
It's
choose the
amazing.
natural product, which is our Healthy Sinus formula, or you can choose Zyrtec or Allegra or Claritin that don't have anticholinergic.
Won't send you into Alzheimer's
right.
world.
Those are fine, correct. Another class of meds that do it are antidepressants that have anticholinergic action, such as Paxil. I just last week took a lady off Paxil and put her on one that does not cause, that does not have anticholinergic action, as well as Sinequan and Elavil. So we want to get on something else, Lexapro.
All right, for the sake of those watching right now, Don, this is really important that when you go to see your doctor, you want to make sure that the med that you're requesting or he's going to put you on is not a
cholinergic. They don't know this. You have to read the book. That does not have excessive anticholinergic properties.
Cholinergic?
These block acetylcholine.
All right.
That is the memory neurotransmitter. So in other words, I'm going to go through it real quick.
Okay.
The main GI meds that do this, like for irritable bowel, Librax and Bentyl or dicyclamine. Those are anticholinergics. You want something besides that. If you're on that long term, it can push your brain toward Alzheimer's. Also, meds for diarrhea like Lomotil or Imodium or the generic varieties of those meds are anticholinergic. Muscle relaxants include Robaxin and Flexeril or methylcarbamol. These are powerful anticholinergics that push your brain toward Alzheimer's, as well as schizophrenia meds. These are major. Haldol, Zyprexa, Seroquel. Wow. These are powerful anticholinergic meds, and that's why many schizophrenics, I believe, eventually develop dementia. And then motion sickness meds like Anavert, Bonine, Meclizine. If you use this long term, this can push your brain toward Alzheimer's. Powerful anticholinergic. And analgesics like Tramadol, Ultram, Demerol. These have powerful anticholinergic actions, see? So these are Dementigens, and it's important, if you're on these, you're 65 or older, have been on for 3 years, you stand a 54% greater chance of developing dementia.
Oh my,
now,
this is
others,
huge.
real important that we need to talk about because we're running out of time is marijuana, Mary.
Yeah.
We are seeing so many people on marijuana now. It's just crazy.
Tell them why the marijuana has become so bad.
Well, first of all, the marijuana, the THC content is increasing. Before 1990, the THC content of marijuana was about 2%. In 2017, the average marijuana content is between 17 and 28%. And now many new THC products like the THC oil gummies and the THC oil dabs have as much as 95% THC.
And why that is so bad for the brain?
Well, because THC, long-term, when you're on high amounts of THC, long-term, high amounts, it literally will cause, eventually, it results in reduced hippocampal volumes, which means you're shrinking your hippocampus where Alzheimer's starts. That's your short-term memory center that communicates with your cerebral cortex or prefrontal cortex to encode your memories in long-term storage. You're shrinking your short-term memory centers. And also it causes significantly worse performance on verbal learning. So again,
well, you can see that with people. I know when I'm talking with someone that smokes pot or they're on, you know, they do it regular, they just are dumb sounding. They just sound dumb. They just can't articulate very well, and they're just slow, and this is like young.
I know.
So I can't imagine what's going to happen to them.
It's the dumbing down of America. It also increases the risk of schizophrenia.
Wow.
And it's just, again, there's other things that we're eating daily or drinking. It can be NutraSweet or aspartame, which converts into formaldehyde and formic acid, which damages the brain. It can be trans fats from brownies and microwave popcorn and cake icing and cookies.
Well, you go into all of this in the book. But
one of the worst,
things.
I got to just mention this last thing, chronic infections, Mary, fever blisters. Fever blisters, chronic fever blisters literally causes the brain to produce beta amyloid.
That is so weird.
And so a simple thing we can do to prevent fever blisters is just take L-lysine, 1,000 milligrams a day, 500 milligrams, 2 a day. That's it. We'll help prevent them.
The fever blisters is kind of an indication your brain?
Fever blisters cause the body to produce more inflammation, and that inflammation translates in the brain into beta amyloid. Your brain is producing
your lips are inflamed.
It's inflammation. And then that'll affect the brain eventually. Long-term fever blisters can eventually affect the brain and cause excessive production of beta amyloid. And so again, not just fever blisters, gingivitis, chronic bronchitis, chronic sinusitis, Lyme disease, any chronic infection, even long COVID. And so I have the natural alternative to actually help the brain and the body fight these infections so that they do not create beta amyloid that's choking the brain and downsizing the brain.
Can I tell you, God has an answer.
Amen.
God has an answer for every disease. He does. And there's a scripture that says, my people are destroyed for lack of knowledge.
Amen.
We want to bring you the knowledge so you aren't destroyed, so that you can be empowered with what to do. If you sit back and wait for your doctor to tell you things.
They don't know this.
They
don't know what it's.
Folks, you have to own your own body. You've got to be aggressive in learning and finding out answers.
Not just learning, but doing. You've got to implement this in your lifestyle, in your diet.
My point is, if you sit back and wait for someone to tell you,
especially if you're in that 60, 65 age group.
Now,
again, after 65, we stand a 5% risk of Alzheimer's. At 85, it's a 50% risk. It's a flip of the coin. And so again, it's critical you start now and start these programs now. And the dietary program, we're going to talk about lifestyle This next program.
But
tell them about
the next program is the most important of the three.
Exactly. It tells us
now we're going to give you
all
answers. I'm going to empower you. You don't want to miss part 3 because it's amazing. So go to drcolbert.com, get your brain kit. You need to get this brain kit.
The Brain Zone kit. That's it.
Thank you.